And you're just going to look right at me.
Yeah.
Okay, so first, if you could just tell me your name and your full title.
Sure. My name is Dr. Monica Lallo. I am with Acenda Integrated Health, and I am the Senior Vice President for Prevention, Youth, and Education Services.
Wonderful. So we've all gathered today for this forum, but can you tell me what is this forum? What are we here for?
So we're here to discuss the strategies around legislation, in addition to just learn from New Jersey the work that we have been doing for the hub for the last 2 years, and then the work that has happened prior, and then to see where we're going next steps in terms of, with all the funding cuts and the impact and the loss of the CDC's CCR funding. That is imperative right now. Our community-based organizations, FQHCs and other entities are just in a quandary in this unprecedented times as it relates to funding.
Perfect, great. So why is a forum like this important? I don't think there's a forum in the next conference room talking about why doctors are so important. So why are we here talking about the importance of community health workers?
Because they are the frontline workers for public health at this point. We saw the work that they did during COVID, and then additionally, they have been doing this work but going unrecognized throughout the country. And so in New Jersey, we are really looking to see how we can make sure that they're sustained and they become a fabric of local public health.
Perfect, great. What would happen if there were no community health workers?
I think underserved communities, under-resourced communities, in addition to racial and ethnic populations that are not getting services in terms of healthcare, we would see devastation because over the 2 years that we have had the hub, we have served over 185,311 people who have been connected and made service linkages in key areas: food, healthcare, family health, transportation, employment, and other resources. And we have seen individuals identified as it relates to chronic health diseases where they have been supported through our Cherry Hill Free Clinic, who was a grant for us. We've also branched out into oral health, where we have seen individuals, pregnant moms who were impacted by oral health are now being seen. That was unheard of. A lot of people are losing services, and we see it more and more, especially in the southern region where I reside and work. From Burlington all the way down to Cape May, the services are not there for our communities.
I think you may have answered this, but I'm going to ask it. Is there anything, you've talked a lot about the impact of community health workers and why they're important. Is there anything else you would want people to know about community health workers?
They are an integral part of healthcare, and it needs to be understood that way and seen that way. Sometimes they go invisible, but they play a key role in all areas of healthcare. They're the thread that would bind and really ensure that doctors and nurses, LPNs, whoever is in that space, in addition to our communities, they actually come from the community. So they understand what the community needs, and having their voices and being an integral part of the policy and practices for New Jersey, but across the country. And that is what the National Association for Community Health Workers is trying to do. And then they know and understand, and they have the lived experience so that they can speak to legislators, they can speak about their community, and they can help us to find solutions, equitable solutions.
Perfect. You just said that basically they're invisible. So what do we need to do to make them visible?
So what we have been doing in New Jersey is really amplifying their voices across all platforms. In addition, we held last year, we had the Community Health Worker Awareness Conference, where we're bringing them to the table, making sure that they are being heard, and wherever we can plug them in. We are in the process of creating a formalized community health worker professional association in the state of New Jersey and making strides with that. So I think once they're visible and their voices can be heard and they gain integrity to this particular process that we're doing, and holding them accountable as well as holding ourselves accountable, I think community health workers will be, an everyday word in our community.
That is fantastic. That's perfect. Unless you have anything else you want to add?
No, I think today's forum is going to be vital in moving us forward in that realm.
Perfect.
Thank you.
Thank you.